You have a nice place here. I feel so alone. I was very ambivalent about coming to get help. I think people should be able to handle their problems on their own and not ask for help. Do most people feel like this? Or am I the only one?
I need to gently focus on her motivation to overcome her problems. She seems quite depressed. She is ruminating and worrying with judgment of herself. How long have you been feeling depressed for?
I think it has been about 3 months now.
When you think back, was there any situation that may have contributed to you feeling this way?
Well, about that time, I quit my job. I then became very clingy with my boyfriend. I really needed his support, but he had his own problems. We started arguing more. It reached a peak when he arrived back at our apartment late from work, and I started questioning him. He finally said he can't take the stress of my mood. He then said he needed space. He packed some things and moved out. Now, he is living with his parents. I cried for hours. I blame myself for him leaving.
Well, it sounds like a reactive depression related to the breakdown of her relationship. I wonder if there have been any other underlying factors. I must get a better picture of her depressive symptoms and assess any risk of suicide. This period of time must have been very difficult for you. How are you sleeping?
Actually, not very well. I keep thinking and thinking all the time. Mostly about negative things. It takes forever to get to sleep, and then I wake up early.
I need to get a clear picture of the extent of her sleeping problem. I will press her for more details, but it must be done gently. You must be exhausted. When is it that you usually, finally, get to sleep on an average night? And what early morning time do you wake up?
Yes, I'm very tired. I drag myself through the day, at work. I lie awake till around 1 in the morning and then suddenly, awake at 5. It's dreadful. And then, my stomach hurts. I just can't get back to sleep. My mind races with thoughts. There's no relief.
I see. How is your appetite?
Why? Do you think I'm fat? Well, I have been eating more. Mainly junk food and chocolate. It seems to give me some comfort when I am alone. I usually eat in front of the telly.
Do you still enjoy doing things? Even watching TV?
It's funny that you should mention that. I mean the TV. I sit there like a robot. I'm staring at the telly, but not really listening. I'm not interested in much these days. My friends say I'm not much fun, because I rarely want to go out with them anymore.
She certainly sounds depressed. I need to inquire about suicide potential. What's your thinking about life most of the time?
Well, quite gloomy. I don't like thinking. I try to avoid it. It always seems negative. Do you know what I mean? The glass is always half empty.
I can see that she is partially admitting how bad she feels, but then partially avoiding. I need to keep persisting to help her face the truth, but also have a clear diagnosis. Sometimes, do you ever have thoughts that life is not worth living, or on some evenings, you wish it would be nice if you didn't wake up the next day?
Well, now that you mention it, yes, I have thoughts like that. Too often to admit. Sometimes, worse than that.
The thoughts that are worse. The ones you don't want to think about. What are they?
Do I really have to talk about that? Haven't I told you a lot already? It's quite personal. I'm not proud of them. Rather nasty. I didn't expect you'd corner me about this.
A sudden wave of resistance. Her character seems stronger than I thought. She is less depressed than I estimated. But I need to be careful. I don't want to create a misalliance. There are a range of intellectual and tactical defenses still functioning in her. However, I cannot afford for her to become defiant at this stage and possibly lose the client. You're under no obligation to answer any of my questions. However, Susan, my understanding is that you come here voluntarily, on your own will, that we could get an understanding of these difficult problems that you face, to bring you some relief of your suffering, and with each other's help, discover solutions to your difficult circumstances. Is this what you were hoping for?
Well, when you put it in that clear way, yes. Definitely.
So, anything you share with me must be based on your will and your desire to help me understand you better. However, if you avoid sharing things, or put some kind of wall between us, then we would not get to truly understand the depth of your problems, or have the hope of working together to resolve your difficulties. Do you see what I mean? Of course. It needs to be your choice, what you decide.
At first, I was not clear what you were saying. But, now I understand that if I do not choose to open up to you, how could you help me? I now realize that I do put a wall up with many people, not just you. I do want to be successful here. I am going to try my best to be more open with you.
How are you feeling now in the session?
I'm actually feeling stronger and more hopeful. I really think that you can help me. I'm also feeling a bit more scared though, of the difficult task ahead of us. However, with you as my guide, knowing that we will be working through this process together, I am ready for the challenges. I am more confident that I can be successful.